It's just not another Manic Monday. It's Monday, Arctic Skin MD. I'm Dr. Melanie Palm. I've got Stephanie Williams, who's one of our amazing PAs, and sweet Julia is actually behind the camera. Thank you for pressing that. We love you so much. And we thought we would do a quick little sort of info, including some interesting ways to get some of the amazing Neocutis products, and talk about Ultherapy, which is one of the skin tightening and lifting technologies we have at the office. So I will let you kind of take it away. Maybe you can give some background about what Ultherapy is.
Sure. So Ultherapy stands for ultrasound therapy. So it's using micro-focused ultrasound energy to target 2 tissue layers. And what we can do is we can actually reach the same depth as what the plastic surgeons reach when they're doing facelifts or neck lifts. And we're able to affect that change to build new collagen, to build new elastin, and help really create a noticeable lift without disrupting the surface of the skin, which is really amazing and incredible for something, that we can do in office. And so once we hit the muscle layer, then we move on to the second layer of our skin called our dermis. That houses our type 1 and type 3 collagen, and that just helps shrink wrap things and helps smooth the skin, helps with that glow, improving skin quality and texture. So, this is FDA cleared for actually lifting the brows, and we notice that there's on average 1.7 millimeter of a lift that we can see. And so with the brows, the full face, the submentum area, as well as the neck, and it's also FDA cleared for tightening the décolleté or chest area. So it's a really popular treatment that myself and Julia perform, and yeah, we love it.
We've had it for a long time. Our practice has existed for 13 years. When I initially opened the practice, I was doing the Ultherapy, and as we've grown, we've had 2 real experts, I think, doing this. So, I tell patients, because they think it's so confusing to try and navigate the aesthetic and cosmetic landscape. I think a lot of times you'll see people on social media and they just talk with conviction, but there's no science behind it. So I think we're trying to dispel some of that. But what I love is that Stephanie and Julia are real, anatomy thinkers. And I think that's who you want driving an Ultherapy device, because it is the only device that's actually FDA indicated and cleared for real-time evaluation of tissues while we're doing a skin tightening procedure. So I really love that, because we can create bespoke, personalized treatment plans based off of the anatomy you're seeing during the treatment, which is really key to getting the results. Because I think if patients have done some of their homework on Ultherapy, the concerns that they have, and we'll go through some of these, is discomfort management. Number 2, is this going to dissolve my fat? And I think one of the ways we really dispel that is what you just heard Stephanie talking about. We're really just in real time looking at tissues, and we're targeting either the SMAS, which is the connective tissue that encases these muscles of sort of facial expression, or above that, which is where we spend the majority of our time, which is the dermis, sort of just shrink wrapping the skin, so that we're not doing anything to affect the fat, which is sandwiched in between, and we're not doing anything deeper, so that we're not sort of affecting what a facial plastic surgeon might do later on. And so I think that's really important. So we'll talk about comfort measures a little later on. You talked about and referenced the first FDA indication, which was the brow, and rightly so. On those studies, which was performed by Murad Alam, who's a wonderful dermatologist at Northwestern, he saw a 1.7 millimeter lift in the brow region. So after that indication came the full face, which includes brow treatment, treating the lower cheek region, and just below the jawline to help with that sort of lifting area. The neck followed, and now we have a décolleté area as well. We don't do as much body work because I think we have other technologies that I just think duration of time of treatment and some of the results we're trying to drive, I think there are sometimes just better options that we discuss with patients. So we really concentrate on face, neck, and chest. But I would say, a lot of times I'm recommending something like muscle toning, a little injectable work, and then we use this in areas of the face and the neck as that final pièce de résistance.
Yes.
So maybe talk about what we're seeing on the screen.
Sure. So as you can see, this is what myself and Julia look at when we're performing an Ultherapy treatment, and we scan your anatomy. And on an individual, one side of your face might not be exactly the same as the other. So before we even administer the energy, we come up with a game plan. And this has deep sea technology. So these are the transducers that we use to actually deliver that micro-focused ultrasound energy. And you can see they come in different depths. So I have the 1.5 millimeter depth and the narrow one here. But this is totally customizable, like Dr. Palm mentioned, based on the individual and the areas that we're treating. So we have as deep as 4.5 millimeter that we can reach under the surface of the skin. We also have a 3 millimeter transducer. So as we're performing this treatment, myself and Jill, we are constantly looking at this monitor. This top half is that real-time ultrasound imaging that Dr. Palm talked about. And we know what the target tissues look like under the ultrasound. So fibrous tissue, the mass, it looks different on the ultrasound versus the adipose, the fat or subcutaneous layer. So we know kind of where we need to be at, and we can change these transducers during the same treatment for the individual.
I mean, I know the last time I had it, we really stuck to just the 3 millimeter and the 1.5. It's pretty rare we do 4.5. I mean, it has to be somebody with a lot of tissue. And I think that's, spending time in that more superficial dermal compartment is really what helps with some of that shrink wrapping and skin quality. This is ultrasound energy rather than a lighter laser based. So, within reason and using appropriate sort of energy deposition, this is something that we can treat on all skin types too.
Absolutely.
Really powerful. Now, is this something you see results right off the bat, or how do you counsel patients in terms of is it one and done? How long does it last? When do you tell them you'll see results?
That's such a good question. So I think the individual results vary, but
it really, if someone understands, and both Stephanie and Julia have been to multiple cadaver courses, so I think they intimately understand anatomy. All three of us are very cognizant, whether we're injecting somebody, whether we're delivering an energy-based technology like Ultherapy, where we're heating up tissue and causing new collagen growth. We're very concerned for safety and for effectiveness at what we're treating. So, you don't want somebody that's a monkey that's just indiscriminately sort of treating this area. And hopefully I don't offend and get canceled by monkeys out there on social media. But you want somebody with a thoughtful approach who understands anatomy and is always looking in real time at this. And I think that's what drives the most results. That's part of the special sauce that makes this more comfortable, because if we're targeting the tissues that we want, it's a much more comfortable treatment. But we do some things like topical numbing. If it's appropriate, we can talk to you about either oral medication or IM, which is intramuscular management, to really make patients comfortable. And I'm sure you've heard it too. I hear frequently when my patients come back from having treatment with you guys that maybe they've had ultrasound-based treatment elsewhere before, but this was a nice new experience because we've done a lot to keep them comfortable during treatment.
Absolutely.
And then, so maybe something newer to Merce. So Merce makes Ultherapy device. They make a skincare line called Neocutis. They're also the manufacturers of Radius, which is a calcium-based collagen stimulating agent that we use. Bellatero, which is a fine line, sort of etched line filler that we really like, and we're part of the Bellatero infraorbital hollow studies. They now have kind of a frequent flyer system. So do you want to talk a little bit about their experience program?
Absolutely. So they have this new point-based system. Now, if you're familiar with other injectables that we carry in the office, they each have their own program that's unique to their product line. And so with Merce, they have Ultherapy as well as Neocutis line. So with Ultherapy, you actually get the most amount of points if you do move forward with the treatment, and you can use those points to redeem for actual credit towards either your next treatment, whether it be a Radius or a Bellatero, or you can actually use it to redeem one of these many products from their Neocutis line that uses growth factor technology. And this is one of the products that we actually recommend and we apply to your face after Ultherapy, just to help stimulate that new collagenesis and help with your body to regenerate that new collagen and elastin using those beautiful growth factors.
So we are going to have, so please, if you've got questions, you're interested in a consultation, Stephanie and Julie are such great resources, I think, in terms of this technology, and have been doing it quite a while, and are just fantastic at it. So please, if you're interested, we can schedule consultations so they can talk to you and really individualize a treatment option for you. And then just know that if you are considering something like Ultherapy, there's opportunities to use those points and even receive a wonderful full-size product from the Neocutis line. And in about a month or so, we are going to be featuring some of similar technologies. We'll have 15% off of some of our skincare line during Body Boot Camp, so stay tuned to that. We'll definitely talk a little bit more about that. But I think Ultherapy, this is a great time to think about it if you're trying to get your face ready for a reunion, a wedding. I'm getting a lot of that right now, and I love that patients are planning ahead and I'm not seeing them like a month before things. But this is one of those procedures we really want to be thoughtful and be doing 3 to 6 months before you want to be ready for something, and using that often in combination with other things, often not the same treatment day, but doing things sort of in parallel along with it to really bring your best face or décolleté or neck forward. So I want to thank Stephanie for your time and describing a little bit of the Ultherapy procedure and sort of what we consider sort of realistic expectations, what to expect with treatment, and some of the add-ons that are being offered through MERS through their new sort of experience program. If you have questions, you want to schedule a consultation, you certainly can contact us. Our phone number is 858-792-7546. We're closed for lunch right now, but we'll be back in about an hour. Or you can look us up on our website, which is artofskinmd.com, and then give your handle for Instagram so people can follow you too.
Sure, it's stephanie.aesthetics.pa.
Awesome. Amazing.
Thank you
I want to
so
thank you
much,
for your
Dr.
time.
Palm.
Everybody have a great lunch out there, okay? And I'm going to old school turn it off for us, okay?